Okay, we're going to take a look at the situation. We're going to start in the United States, work down through the state, Pinellas County, and ultimately to what's happening here at Regency Oaks. What I can share with you is that the numbers that we started to see trend downward last week, that trend has continued for a consecutive week, so that's a 14-day average. What we're looking at here is the 7-day rolling average of new cases, and this is for the United States, and what's listed are the states at the high end of the spectrum. You can see that in Florida, we're at 99 cases per 100,000 residents. That's the second highest in the United States, where Mississippi has the dubious honor of having the highest percentage across the country. That is an improvement of about 10 plus basis points for Florida week over week. So if we look at the United States and go back to a broader picture, new daily reported cases went up about 5.5%, and the new daily reported deaths rose about 29.6%. Now you'll recall that last week that number was above 200%. So there was significant improvement week over week in terms of the number of people who are expiring from COVID, specifically the Delta variant. COVID-related hospitalizations fell by 1%. That is not a large number, but boy, is that a significant number that we desperately needed to see, not only across the country, but specifically right here in Pinellas County. Among the reported tests, the positivity rate was 10.8%, that's across the country, and the number of tests reporting fell by 44%. So that's a really important number. That is a leading indicator, and so you can surmise from that statistic that if the number of people who are testing, not the results, but the actual number of people who are testing fell by 44%, there's a correlation between the number of people who are ill and the number of people who are deciding to test. So that's a really good leading indicator that we're beginning to turn this curve. This is the statistics from the Florida Department of Health that looks at what's happening here in the state of Florida. It's an overview. New cases, the positivity rate dropped to 16.8. You can see the cumulative total. It was really high last week. And so we had a decline week over week of about 3 to 4 points. And the total number of new cases for the last 7-day period was 151,000. Now that's really high, but it is an improvement over where we were the prior week. In terms of the vaccinated individuals in the state, last week we did 184,000 new vaccines and finished up 276,000 second shots. So we really took a positive direction in terms of the number of people who previously had not been vaccinated and have made the decision to go and get vaccinated. So improvement there. 65 plus, we are about 87% of those individuals 65 or older who are vaccinated. That number is pretty stable. But look at the significant improvement that we saw in the ages 12 to 19 and 20 to 29. We're almost at 50%. That's a vast improvement of where we were 3 weeks ago, where those numbers were down in the low 20s. Okay, here is the new cases for the past 10 weeks. You can see back on June 18th, the numbers started to rise. They pretty consistently rose for a period of 8 weeks. And then over the last couple of weeks, we've seen a decline. 8/6, we were 151,000. 8/13, 150,000. It bumped up just a little this week, but if it's not declining, I think it is fair to say that we have at least hit a point of stabilization. So new cases appear to be stabilized, and hopefully we'll see a decline in this 7-day period that we're just entering into. Here's why I think that decline is something that we can reasonably expect to see next week, and that's because of this chart. This is the new case positivity for the past 10 weeks. You can see same pattern. It rose very consistently for a period of 7 weeks, and then we saw a 19.6 at 7:30. It fell to, or it climbed 0.2% to 19.8, continued to climb just barely to 20.1, and then we see the leading indicator of that improved positivity rate of 16.8. And so you can see the increase, the stabilization, and then the beginning of the curve. Here's a number of doses administered in the past 10 weeks. You can see that, somewhere the middle of July, those numbers started to increase. On 8/13, we were doing more than 200,000 more shots per week than what we were in the second week of July. So very significant increase and vast improvement in the number of people who are getting administered the vaccine, and that's how we're beginning to see the herd immunization occur, and we're seeing improvement in those numbers week over week. Okay, let's take a look at Pinellas County specifically. The data on the left-hand side is the cumulative data, and so the population in Pinellas County is 992,000. We're right at 1 million. 569,000 of those individuals are vaccinated, which means that our percentage of vaccinated population is almost at 64%. We've seen that increase from 58% just a few weeks ago. So we are making progress in getting people vaccinated. On the right-hand side, I want to zero in on the positivity rate. You'll recall that last week it was 20.4. This week it's 18.0. So that's a 2.4% increase. That's a great decline in a 7-day period. What we are looking for, you may recall, is anything below 5% allows you to completely remove all restrictions, and anything below 10% allows you to make pretty much a broad, significant reduction in any restrictions. And so that number continues to be an important number for us to watch and follow. Okay, so this is the case history. This is specific to Regency Oaks. It's the number of reported new COVID cases. We've added on additional information. The last time we shared this was back on the 20th of August. And so we've added in the information for the last 10 days. And you can see I've also broken this down into colors. And so I just want to walk through this. I know we talked about it last week, but this is the basis that we're looking at to help us evaluate when and if it's safe to reopen. And so the bar graphs that you see in blue, those are the original COVID exposures. And you can see that there are numbers that on the 10th we had 5 people, on the 11th we had 2, on the 12th we had 5 more, followed by 2 low exposure days, and then August 15th we had 8 exposures. So those individuals represent the initial exposures that we had at Regency Oaks. What you are seeing in the red are the secondary exposures. And these are people who may not have attended one of the 4 events that became spreader events, but they came in close contact with an individual who had attended one of the event. A couple of things to note here. One, look at the intervals, because the interval tells us that's that 5-day spacing that we're looking for, that's an indication that you have successfully gotten beyond the exposure. And so we do have that separation. It's not quite as long as we would have liked to have seen. It was a single day, but we did get the separation. The second thing to notice in this chart is if you look at the cumulative numbers, it was not as strong reaction as the first exposure. That's exactly what you're looking to see, is you're looking for a decline in the numbers. If you go to the right-hand side of the chart, this is what's happened over the 10 days, and that's in yellow. And you'll see that we had 4 consecutive days with no new cases across campus. We were really excited. Came back on that day and shared the news that it looked like we were going to be entering the 5th day. And what do you know? On the 25th of August, we had to report that late the afternoon of the 24th, we'd had 2 new positive cases. And then we had 1 new positive on the 27th, and we had 1 on the 30th. Let me talk about those new recent exposures that you see in yellow. All of those are not connected to either the original or the secondary exposures that you see in blue or red. We've done the contact tracing on all of the recent exposures, and we can categorize them as contained exposures. And so what do I mean by the term contained exposure? This is someone that might have gone to the hospital, they came back. Our standard requirement post-hospitalization is that you go on a 10-day quarantine, and then during that quarantine period, you might have tested positive for COVID. It's contained. You are not a risk of exposure to any other resident on campus. Another example is someone who might have seen a family member, and a family member tested positive. They called us and said, hey, I was exposed, I've exposed my parent, they potentially are exposed, and we are able to immediately quarantine that exposure to make sure that it doesn't spread resident to resident. And so, yes, we have continued to have people pop up as positive, but they've been isolated incidents, they've been contained, it's not a group spreader, it's not a mass exposure, and we feel we're very comfortable now that we've gone 10 days without an event or a trigger that would have us concerned. So right now, today, we just finished our COVID meeting, and there we have routine testing going on. We are routinely testing all staff, and we're routinely testing our skilled nursing center. But across the campus, there is not a single resident or a single staff member that we are currently testing because we suspect that they have COVID or that they are exhibiting flu-like symptoms. So again, given the data that we've looked at, and we're ready to start this reopening process. Now, let's talk about what that's not going to look like. You'll recall that when we rolled out of the shutdown starting in May of 20, not 21, May of 20, there were 11 different phases, and between each phase was a 21-day interval, and that process just went on forever. That's not what this is going to look like. This is going to be a much quicker process. It's going to be a stepped approach. It is going to be phased, but instead of there being 11 phases with multiple days in between advancing from one phase to the next, we're going to break it down into 2 phases. We're going to move quick. It's still stepped, and we're going to break the process into what we consider exposure risk. And so in the first phase, we're going to focus on group events, and then in the second phase, we're going to worry about person-to-person exposures. We don't want to reopen the entire campus across the board all at one time, because by doing it first with the groups and then the individuals, we get better control in managing the risk. So if we have to take a step back, or we get multiple residents to test positive on the same day, we're able to very specifically go back and determine where the risk factor was, where did the exposure occur, and we don't have to try to figure out, was it a group event that someone attended because it's a multiple person exposure, or was it a person-to-person exposure, meaning someone who had direct one-on-one contact with transportation, housekeeping, maintenance, or IHS. And so we're breaking it out into two phases, and we'll take a look at this rollout. Okay, the first phase of the rollout is going to be Wednesday, September 8th. So that's not tomorrow, but the following Wednesday. As always, as we move forward, we have to remind you to wear your mask, practice good social distancing, wash your hands frequently, and tell somebody if you are sick. I want to repeat that last one. Tell someone if you are sick. It is more important than ever that if you are experiencing symptoms, that you not wait. And I understand. Nobody wants to go to the hospital. A lot of people don't want to know if they've tested positive. But telling someone early can make the difference between a positive COVID, where you have very mild or moderate symptoms, and a positive COVID exposure where you are seriously ill. Telling someone sooner rather than later is critical. So in this phase one that will begin on September 8th, both dining rooms will reopen for dinner services. The dining rooms will not be open for lunch service in phase one. The same thing with the tavern. It is not going to reopen in phase one. The salad bar will open with precautions in both dining rooms for dinner service. The salad bar precautions, the good news is we're not going back to the bamboo utensils. I know that will make many people happy. We will require that you have your mask on in order to go through the salad bar. We will have a sanitation station at the front end of the salad bar. And of course, we'll have the sneeze guards in place for safety. In our dining rooms, there will not be table restrictions, so we're not going to limit the number of households who can be at any one table. So if there are 4 single individuals who want to sit at one table, or a party of 6 that may have multiple households and want to share the same table, that's going to be fine. There are no restrictions. The Regency room and our specialty dining will not reopen in phase one. Transportation will open for one-on-one appointments. So if you have an appointment with your physician, or you need to get up to see your financial planner, any professional appointments, those one-on-one appointments handled by the cars will be something that is returning. What won't be returning in phase one is bus transportation. Housekeeping will not return in our phase one. So for next week, for beginning on the 8th, we will continue to do the housekeeping services that we are doing right now, which is limited to the weekly linen changeover. Our maintenance department currently is doing emergency work orders for HVAC, air conditioning, electric, and plumbing. So if you had one of those 3 issues, we were allowing maintenance to come in and handle emergency work orders. We will not be returning to a full wide open maintenance department, but we are going to add 2 components. So if you have a critical repair to a critical component, such as a dishwasher, a microwave, an appliance of any sort, those repairs would be allowed, as well as any safety issue. You have a light bulb that needs to be replaced in a closet, or you have a fall hazard that needs to be addressed. So those 2 new additional maintenance areas are going to be added to the work order list. For our lifestyles team, we're going to open back up for small groups of less than 15, and that's whether they are outside instructor led or led by residents. So all of our committee meetings and group meetings for small groups will be allowed with appropriate distancing and right sizing of the space where those events, meetings, and activities are being held. Coming soon in the phase 2 rollout are group activities, bus runs, parties, and events. Okay, so that's our announcement that we wanted to share today. I know many of you will be pleased that we're taking this first step and getting back to normalcy. Phase 1 starts Wednesday the 8th. Our target date for phase 2, which is when we will reintroduce the rest of the services, events, and activities, is the following Wednesday, the 15th of September. So this is not a long period. The process is all going to be accomplished in 21 days over 2 phases. I'm feeling confident that we can get through this. The numbers support us being able to take this next step, to move quickly. I will continue to ask for your support as we work together to keep our residents safe and prevent the spread of this virus. If you have any issues, concerns, questions, don't hesitate to give me a call. Visit with any one of the department managers. We're here to support you and assist you in any way we can. Have a great afternoon. I'll see you soon.